So I would like to welcome our next team, TOPPA.
Hi, we're delighted to introduce you to TOPPA. We're designing surfaces that support human health and well-being. We're starting with a problem that's all too common but entirely preventable: pressure injuries. They're damage to the skin and underlying tissue caused by prolonged contact with surfaces. They're prone to develop under the bony prominences of the body, including the sitting bones and the heels. So people who spend a lot of time sitting or laying down are most at risk, including individuals who have physical disabilities. They're so problematic because they're essentially open wounds, which means they're easily infected and come with severe pain. They also progress rapidly, which makes them difficult to treat and can cause reduced mobility. And in extreme cases, they can even lead to death. There are 2.5 million new pressure injuries in the US alone every year. And over a 5-year period, that's the equivalent of 12.5 million new pressure injuries and $60 billion of medical costs. And we know that as it stands today, unfortunately, 50% of all wheelchair users will develop a pressure injury in their lifetime.
Healthcare professionals prescribe body weight tilts to relieve pressure and offset risks. This is where the individual shifts in their chair for around a minute every 15 minutes. This is really difficult to do safely, as there's actually risk of falling out of your chair, and for those with limited core strength, it can be really hard to do the tilts properly. Not to mention, every 15 minutes. Wheelchair cushions are also used to help redistribute or relieve pressure, but studies show that the majority of wheelchair cushions on the market do not do this to the extent needed.
So we need a new solution, and we need it now. We need to remove pressure from at-risk areas. We need to automatically adapt pressure to each individual's profile, and we want to be able to measure and evidence impact. We want to do all of this to empower our users and support their independence regardless of their level of mobility or the access to good quality care that they may or may not have. Some products offer different parts of what's needed, but TOPPA is the only solution that integrates all of these key needs into a single surface.
After more than 200 hours of research, interviews, and testing with leading clinicians, we've developed TOPPA. TOPPA is a wheelchair cushion that's developed to prevent pressure injuries and adapt to the needs of every user. At the core of the design is an array of small segments that are each independently actuated to allow for control of every area on the surface. Each of these programmable actuators can move vertically to relieve pressure in a given area and change the pressure distribution between the user and the cushion. The surface top is foam to allow for maximum comfort and a safe user experience. To be able to adapt to the needs of each user, we are integrating a fabric with pressure sensing embedded in that collects the data for every person that uses it. This will drive adjustments to the pattern of movement for every person that uses it. The frequency of the movement and pressure sensing information can all be managed via an app where the user or their carer can use an autopilot mode or use the app to control the frequency, pattern, and depth of adjustment.
The cushions available on the market today don't offer an effective solution. We're setting ourselves apart from other products by removing contact with the skin surface and using pressure sensing to provide customized relief. We're innovating both in the materials and the mechanism, and providing evidence of effectiveness, which is what wheelchair users deserve. Our go-to-market will be direct to consumer, building on the relationships we've started to cultivate with support groups. We know our users prefer to purchase based on recommendations or reviews. Initially, our target buyers will be wheelchair users and their carers, for whom a real solution would be priceless. Anyone can become a wheelchair user, whether that's a temporary or permanent situation. There are so many use cases beyond long-term disability, including advanced age, recovery from injury or surgery, and also treatment at hospital. In year one, we'll be finalizing our prototype and seeking regulatory approval. In year 2, we'll conduct a pilot and open our online store and win our first domestic customers. And then in year 3, we'll scale up and expand internationally. We're targeting a price below $400 per unit and intend to sell our first 5,000 units by the end of the 2nd year. And we're estimating a profit margin of 65% that we'll reinvest into the business for R&D that will help us to further reduce costs and innovate.
We recognize that wheelchairs aren't the only places that responsive services could add value. We plan to expand to the healthcare market in the form of hospital beds and reclining chairs. There's potential to grow our market to all seated surfaces and translate TOPPA across everyday furniture.
We're a team motivated by personal experiences with loved ones who are wheelchair users, and we're passionate about applying technology for social good.
And we're grateful for the support of this community as well as PKG and Spalding Hospital. You can continue to follow along for our journey by signing up at this QR code here.
We're interested in partnerships that help us access lab space, interns, materials or sensing experts, and pilot applications, and we're also just looking to expand our community. We're excited to help you thrive on TOPPA. Thank you for listening.